Hi folks, my name is Nora and I'm joined here with...
Hi, I'm William. I'm just finishing up my second year in Bachelor of One Health with a minor in chemistry.
How did you hear about the Bachelor of One Health program and why did you choose to apply?
So my memory of when I applied to the program was, I don't quite remember how I found out about it, but I remember reading it on the university website. I think I had decided I wanted to look into Guelph as a school, and I saw this program and I saw it was still very, very new, it was still being approved and everything. And I saw sort of some ideas about what the program was actually about and the kind of classes, because I had also applied to Biomed at Guelph, but I ended up applying to One Health. I was in an Indigenous Studies class actually at the time in high school, and I think that class sort of gave me a lot of ideas of knowledge and philosophy that would be part of One Health as a program. Sort of gave me some idea of Indigenous philosophies and knowledges. And I thought that was sort of a part of the One Health program, and I really liked that as well. But I also was sort of interested in just more generally in biology and science, but how to apply it and how to work in as public health, medicine, that kind of stuff. So there's a lot of things I think that went into it.
Now that you're finishing up your second year, what do you like most about the program so far?
I think the thing I like the most is the diversity of classes that are available. It's a good mix of different things like anthropology, biology, chemistry, but then geography, and then there's sort of some of the classes that just tie everything together where you just see those connections start to form. That's where it's really cool.
And what is your definition of One Health?
Oh, this is a good one. This is something I get asked every time when I tell someone I am in Bachelor of One Health, what's that? What is One Health? But my answer is generally that it focuses on sort of making those connections between humans, animals, the environment, and sort of what it means to be sort of healthy. What does health actually mean for not just for an individual, but for a population, for a region, for an ecosystem, and sort of building those connections and that web of what's the word I'm looking for? Yeah, building that sort of web of connections and that web of knowledge is really important to One Health, and that's sort of what I define it as.
Based on what you've learned so far, do you have an idea of what you'd like to do with your career after this program?
Yeah, I'm still sort of figuring that out a little bit, but I think One Health gives you a really good opportunity to sort of look at different things that are available and explore different areas of health, medicine, science that you might be interested in. I'm still sort of interested in maybe some research side of it, maybe something in public health research, epidemiology, those kind of things I find really cool. But then also, again, I've studied a lot in chemistry, and there's sort of a lot of ways that can become part of One Health as well. So looking at things like toxicology or environmental medicine.
And how did you like case studies in One Health or One Health 2000 this year?
So case studies in One Health was a class I took last fall, and I found it really exciting because it did sort of give you that opportunity to build your knowledge of things. So you come into that with your knowledge of biology, chemistry, anthropology, and all these sort of different ways of thinking about things. You come into 2000, and it gives you the chance to apply that. We did I think 2 or 3 different case studies throughout that course, where you worked with a group and did a deep dive into something specific. So for instance, I think one was on food insecurity in I think North Africa. It was food insecurity, and we were sort of looking at, how does that, food insecurity is an issue. There's causes that are directly to that, but then what are the consequences? What are the consequences of food insecurity in the community? How does it affect diseases? Does it make people more susceptible to diseases? How does access to drinking water affect them? How does clean drinking water affect them? And then we started to look at sewage and sanitation, and it sort of just balloons into this web of ideas and of concepts, and I think that's really cool. 2000 gives you a lot of the resources to be able to look at a system.
What was your favorite lecture or concept taught in class?
My favorite probably was systems thinking. That is a major idea of 1000 and 2000, really the entire One Health program, is systems thinking, which is to be able to take a look at an environment and understand different systems that are taking place. And I'll give an example of We looked at Lyme disease, for instance. And so you would look at, like, for one, the life cycle of ticks. And that would sort of be a subsystem of your research, would be sort of how do ticks live? What is their life cycle? But then you would also have, like, the medicine that people were being provided. How does the medical system work? How does it work? How does it not work? How are people impacted by that? And sort of you see, as you zoom out, you see everything come together. And it's sort of hard because you need to keep a scope so you don't, like, get to a point where you can't understand anything. And that was something that we were also taught, is sort of where to draw your sort of bubble around your system of what you actually want to take a look at. But that was probably one of my favorite concepts from Case Studies in One Health.
And while taking a whole bunch of other courses that may not be specific to the Bachelor of One Health degree, how do you find yourself drawing in those concepts that you learned in Introduction to One Health and Case Studies in One Health?
Yeah, so I think it really gives you sort of the opportunity to think about things in a different way. I'm going to go back to what I said about systems thinking. It's sort of a way to think about any environment as a system. So for instance, I'm in a course called Qualitative Methods in Social Science. And it is a mandatory course for One Health, but it is also not necessarily, it doesn't necessarily fit with everything else, I'm going to say. But I'm applying that to a completely different context because I'm doing a project on university governance and, like, how students interact with university governance administration. And I've used my knowledge of systems thinking to sort of look at the university as a system and see how students interact with it and sort of find those points where students interact with it and how we can improve their experience and how we can work on it. So I think it's not necessarily related to One Health, but it is sort of still using that knowledge from 2000 and from 1000 as well, actually.
Mm-hmm. So now that you're done your second year, typically BOH students declare an area of emphasis at the end of their first year. What area of emphasis did you choose, and how are you liking the courses specific to that emphasis?
Yeah, so my area of emphasis in specific is disease complexity and health, and that really focuses on sort of not necessarily like the human body, but focuses on like how diseases impact us or impact the environment, and then what the consequences of those diseases are and how we can treat them, how we can prevent them in the community. So there's a couple classes I've taken so far that are for that. One of those is microbiology. It's like all sorts of bacteria and fungi and all that kind of stuff. There's two really great profs that taught that class, probably one of my favorites from this year. But that class sort of goes into sort of how do you identify bacteria, how do they look, and then like the first half was sort of identifying bacteria, bacterial ecosystems, that kind of stuff, and then the second half was all like microbiome, like the human microbiome, animal microbiome, and how microbes interact with our environment. And then the second course that I'm in right now is called Principles of Disease. It's a pretty hard one, but it is a lot of information, and it really is sort of looking at all of our sort of human body systems, or even, it's not even specific to humans, it's more of like body systems and how different diseases impact them, how they function normally, and then like what it looks like when you have a disease state, and then sort of being able to identify those diseases and figure out how like treatment for them works. It's a really cool sort of concept, and I love the prof who teaches it, because he is a vet school prof, but it's still very applicable to like human medicine, I think, as well.
What's been your favorite class so far, and why? And was there a specific lecturer or professor in mind that you can think of?
So probably my favorite class that I've done so far was, it's called Anthropology 1120, Biological Anthropology. If you're first year in One Health, you will have to take it at some point. But part of it is for the prof, Dr. Travis Steffens. He is a researcher in Madagascar, and he focuses on researching like the ecology of lemurs in Madagascar from a One Health perspective. So he knows he knows sort of what One Health is, how to work it into lessons, even though it is more of a less specialized class than that. But it sort of covers the evolution of humans. How did we sort of go from like where did apes come from? Where did humans come from? What were early humans like? How did they live? And then you'll also sort of learn how to identify like species from like skulls and the different features they have and how it affected their lifestyle. That was, I think, probably the coolest part of that class.
So you mentioned that you're doing a minor in chemistry in your Bachelor of One Health degree. Why did you choose to do chemistry?
Yeah, so I took first year chemistry, which is like, it's one of those classes where a lot of people struggle with it and a lot of people really don't like it. I was somebody who I kind of found I enjoyed the first year chemistry class, was one thing, but also something I just wanted to specialize in. I found like topics in pharmacology and toxicology very interesting, and I wanted a chance to take some more like advanced chemistry classes to see how that can be integrated into medicine, public health, because there's a lot of applications of chemistry to, say, wastewater treatment or to like testing for diseases. There's a lot of applications of chemistry in One Health and in health as a whole. And I saw those concepts really cool, and I was like, I wanted to take some of these classes. I'm in organic chemistry right now, which is a struggle, but it is very interesting topic-wise. And then I did an analytical chemistry class, and there's some environmental chemistry classes as well that I want to take. So it's been a good opportunity to sort of specialize a little bit in one kind of knowledge.
What are you looking forward to most in your next year?
I think I'm looking forward to getting a little bit more specialized, because like first year especially, but second year as well, you're sort of looking at a broad spectrum of things. Like first year, it's all sort of, you get everything. Here's like your introduction to anthropology, biology, chemistry, geography, all of these different sciences. And then second year builds on that a bit. And I'm taking some third year classes right now, and they're some of my favorites. Like I'm in this qualitative social science class that's sort of really giving the opportunity to sort of specialize in things that I want to look at. And it's not, the research I'm doing in that class is not necessarily One Health related, but it is still very interesting to sort of be able to specialize in more distinct things. And then also just having opportunities to be involved with research, anything like that, in One Health or in like social science or anything like that. There's a lot more of that come third year, so I'm really excited to sort of specialize, branch out, but also to get involved more with like research.
And what's one piece of advice that you would give an incoming Bachelor of One Health student?
So I think there's like some advice I would give to any student coming to like Tubman to Guelph, which is really get involved with things. But I run a musical theater club, and I work for the student union, and I've done all sorts of stuff around campus in terms of like volunteer opportunities or like student government opportunities. So get involved in that kind of stuff, because that's where you really start to find the people you want to work with, find some connections, and get a lot of experience. But then for BOH specifically, my recommendation is to try and do, like for first year, to be very broad with your kind of what you're doing, which is very helpful. Like it is, first year you get a lot of the same classes and you get the chance to sort of look at a broad spectrum of things. But the exciting thing about that is that you see how they all fit together. Like as you start to, I think by the time I got to like maybe the second half of first year, I was seeing, you know, these same concepts would come up across different classes, but they were taught in different ways. And that's when you sort of start to build the like web of thinking about things. And then you can apply those concepts to an environment. So take a look at sort of something that's going on in the real world, and you can apply these different sort of ways of knowledge to that field. And that's when I think it starts to get really exciting.